Greetings, Grand Lakers. A few weeks ago, I shared a letter with you that Dr. Zack Bechtol out of Grove, Oklahoma, had written to his fellow Rotarians. He authorized me to share that on social media, and many of you shared it over and over again because it was filled with valuable information. This morning, we're headed over to sit down with Doc in a video environment and have him answer some questions and speculate a little bit about where we're headed with this coronavirus. We hope you enjoy the production. See you around the pond.
So we have been dealing with COVID here in Delaware County since March, and it hit here in one of our local nursing homes. We had 15 or 16 deaths, and I think that really hit home as to the reality of how serious this virus was. We got prepared to deal with the virus and make plans at the hospital, and everything kind of shut down. And then we really hit a lull where there wasn't measurable disease in our community. And so I recall sending a letter to you back then about the whole mask issue, and we kind of had some discussion about whether or not that was crying wolf or whether or not we were being appropriate. But lots of discussions since then. What's the right thing to do? What's the right response? Ultimately, what we've learned is that it is a serious virus. It does prey on the elderly and then certain subgroups within our community. The Indian community has had especially been hard hit. Some of our Hispanic communities that are around the area that work in some of the plants and chicken plants have been especially hard hit. So then fast forward to about after 4th of July, we started to see the numbers increase, and I think most people kind of understand, well, anytime we've had gatherings, holidays, Memorial Day, July, the holidays, we've seen an increase in the numbers. And I don't think that's too big of a surprise. We expect to see when people are getting close contact, the mask really doesn't help you. You're in close contact, you're going to spread the virus. And so we started seeing an increase in numbers late July and September. One of the things that we did here in Grove is we worked with the local business communities to have an alert system so that when you drive through, at least the community of Grove, any billboard, about 3/4 of the people that have professional billboards participate in our COVID alert system. And we use our Delaware County numbers that come from the state. And we have the mayor issues an alert every day that represents what is going on in our community. And once we reach a certain threshold above 25 cases per 100,000, we go to orange. And once we get above a certain number above that, we go into red. Well, we've been in red now since September. Over 3 months of being in red, meaning really a high prevalence of the disease and a risk to those that are in those at-risk groups that we really want them to take as much precaution as we can. And then the thing that we've all struggled with is just the fact that it's been here, it's disrupted our lives, it's disrupted our businesses, it's disrupted our jobs. I know even in my job, we don't see sick people. We don't allow sick people in our office. How do you keep a family practice open when you don't see sick people? So we've had to learn how to do things by video and video visits, and we've learned to go examine people out in their cars, and we've had to make adjustments just like I'm sure many other people's businesses has as well. So now here we are. We get to the end of the year, and amazingly Operation Warp Speed has come through and provided a vaccine, and so we're now headlong into getting our most vulnerable people in our community vaccinating, which is just a wonderful thing. And I hear stories at the health department where they're vaccinating 800 people, and there's just tears of joy in their eye when they get their vaccine. So because they know they're going to get to see their family more than they've been, they're going to get out of their basement for a change. And so I think we're living a very much optimistic time right now. There's definitely some things that we need the public to be aware of, and we need to shift gears a little bit, maybe more from slowing it down and protection to really embracing immunity and moving forward with that. On the vaccine issue, I think we really all need to send the Delaware County Health Department, kudos and a thank you cards, or maybe, a batch of cookies, because everything I've heard from my patients who've gone and participated in the process of signing up, showing up, and getting vaccinated has been very professionally done. It's a hard thing. We've got more demand than we have supply, and so we have a bottleneck. It's going to be like that until we get through this phase 2. But I've had a lot of questions from people about, is the vaccine safe? What's the complication rate? What's the side effects? And we already have numbers on that. We've had about 2 million people vaccinated just right out of the gates, and they followed those patients. There was a 0.22% adverse event rate. I mean, that's pretty remarkable. I think they only had 12 people out of 2 million that had anaphylaxis, which is the most serious kind of allergic reaction. You would have more reactions if you handed out peanut butter sandwiches. There's more people allergic to peanut butter than there is that. So really a very safe vaccine. I've heard people that they don't want to get it. I think that's fine. If people have reservations and they want to hold back, that's fine. There are so many people that want to get it right now. We have more than enough people waiting than we do people worried about not getting it. It takes about 2 weeks for your immune system to really process the vaccine and start to produce antibodies and start to provide immunity. So within 2 weeks of your first shot, you're going to start having immunity, and then you get the second shot, and that kind of seals the deal and provides you more long-lasting immunity. I think there's been some frustrations with the process and getting signed up, and I think for people that they just need to be patient. The one thing that we've learned is that in Delaware County, I think Thursday is kind of the day they start to open up new slots for the vaccine. So it doesn't do you a lot of good to call and call and call, for 2 weeks. When they're going to start opening up new slots. If they filled up and you didn't get a slot the first time, wait till the next Thursday, wait till they open up the slots, then call and try to get signed up. Same thing is true for your second dose. If you get a second dose and you're not going to get your second dose, or your first dose, and you're not going to get your second dose of the Moderna for 4 weeks, don't call every week. It's not going to help you. Wait until 1 week before your dose is due. Call on that Thursday or get online on that Thursday and get signed up. You're not going to have to go searching, I think, very far to get your second dose. But be patient. If you haven't got your second dose by the time it's come and it's past a week, get a hold of your doctor and get some information, or try to contact the health department, find out what happened. I just don't think that's going to happen. So 2 weeks after your second dose, you're golden. So life resumes. So. Things that we are learning is that once you have COVID and you start to get symptoms of it and get into it a week, you may not have any severe symptoms until you get 10 days, 2 weeks into it, and then you're in trouble. And most of the things that we've done in trying to treat patients in the hospital has not been what I would consider successful. So, and this kind of goes along with other things that we know about viruses. I mean, if you get influenza, the flu, and you want to take Tamiflu, you got to take it 24 hours from the onset of symptoms. If you get shingles and you don't want the neuropathy and you've got a rash, you got to take it the first day the blisters break out if you want any benefit from acyclovir, an antiviral. So why would we think that coronavirus would be any different? We need to start treating people much sooner in the course of this. And it's a little harder problem because to prevent one person from dying in the hospital, you have to treat 100 people that are at risk to save that one. And we can't just wait to see who the one is. And then it's too late. So it's a little more of a logistics problem, but we really want people to not be in denial. Do not assume that it's just a cold or sinuses or allergies. Just contact your doctor. We can get rapid testing done in our county now in 24 hours, in a day. And we have Indian clinics are doing it at Cherokee Nation, at Wyandotte. Rapid Remedy here in town is doing it. The ER can do it, and then we can do the other PCR tests. But the bottom line is get tested and then get with your doctor. I have about 7 or 8 things that I do with my patients to make sure that they're doing everything they can to have a good outcome and not be that one patient out of 100 that ends up in our ICU. The other thing that's available to patients that are at risk. So if you're over 55 and you have heart disease or you have diabetes or you have COPD, or maybe you're Native American, or you're Hispanic, or you're overweight, that's enough to get you the IV antibodies. And so again, that has to be done through your doctor's office. They send a referral for you to get those antibodies. But boy, let me tell you, you want to talk to people that have a clinical response. It makes a huge difference, and they feel it. They know something happened about 3 hours after they take those antibodies. They feel that antibody working in their body. So vitamins and vitamin D, we'll talk about that a little bit later, but the main thing is to not be delayed. Get with your doctor. Don't wait to see if you're the one that's going to have a problem 10 days later. You need to start getting information and get up to speed with what we've learned as soon as you think you're sick, or even exposed. I start treating my patients if they have a family member or close contact and they've been exposed. We start doing all these things before they even get their test results back, or before they even have symptoms. So those are important things. Important are supplements and vitamins and some of these things that you've heard about around the community. There's vitamin D, there's vitamin C, there's zinc, there is melatonin, there is Pepsid, and then there's hydroxychloroquine and ivermectin. All these things have been really studied a lot. Probably ivermectin is the newest thing that we don't have as much information about, but great data on the vitamin D and how it affects the life cycle of the virus. The same people that we tend to have complications with COVID, again, overweight, Hispanic, Indians, African Americans, they all tend to be more vitamin D deficient. So, and we don't know the full answer yet. There may be those subgroups need to take more vitamin D than the rest of us. But right now, we definitely recommend 1,000 units of vitamin D for everybody during this season to try to keep that from causing complications. And then great evidence on zinc, melatonin seems to be helpful. And then ivermectin has some really interesting studies that are coming out. We'll probably know more about that in the next 30 to 60 days. There's 21 studies going on or 21 countries doing studies with ivermectin. So we'd all like to know whether or not that really helps or not. It's a simple thing to take. One dose protects you for about a week. And many of the physicians around are trying that with their patients. Again, you want to do it early when you've first been exposed or the first day you're sick. So if you wait a week to call your doctor, you're not going to get the maximum benefit of something that you could take early that really would probably help you. So. In closing, there's several things that are coming down the pipes. One is, when are we going to be out of this? When is this going to end? And if you look at the numbers, we've had about 3,500 patients test positive in Delaware County. Modest estimates, anywhere between 6 and 24 people out there for every positive test. And then if you look at the other data that shows about 30% of people are asymptomatic. All right, so you guys can do your math and get your pencils out. But if it's simply 10 people for every one positive, that's 35,000 people in our county that have already had this and probably already have immunity. You throw in the 30% that are asymptomatic that never even knew they had it, and then you add all the people that are getting vaccinated, we're going to be out of this really soon. And the proof will be in the pudding, which will be, we'll see the numbers go to zero, or they'll go down to a trickle. We're not there yet. It hadn't happened yet, but I expect it's going to happen pretty quick, especially for our county. Is that going to happen in a big city where the population density is much higher? No, it's going to be slower. So it's another good time to be in a small community where you don't have to get on a bus or a subway or ride an elevator to get to your job. So you can avoid it, and the numbers for our own county are going to show herd immunity. New variants, I think the variants are kind of almost like worrying about the asymptomatic group. Can't see it, can't do anything about it, no real reason to worry about it. But it's not, I don't think it's going to be a variant that's going to affect the vaccination or affect the immunity from having it. It would have to be a really big change in structure. These are all called viral mutations. So the virus mutates, it changes its surface proteins a little bit. I don't think it's going to be something we can know what's going to happen yet. It's too early. So They know that the one in Britain is a little more contagious. That might be a good thing. We're trying to slow it down and wear masks and do these things, and it may make that completely obsolete, where it's just going to spread through the healthy population just in time as we're protecting the at-risk population. So that may be good. It may help us get to herd immunity sooner. The one in South Africa strain seems to be maybe a little more deadly. So that would be the one that you'd be more concerned about. And they're restricting, travel from those places right now. So that's good. If you have any other concerns or questions or need a local doctor, I've been practicing here for 22 years. You can contact us through our local office at 918-786-4664.